Hi, you guys. Welcome back for our daily practice questions. As always, I like to get into my introduction and disclaimer before getting started with our questions for today. For those of you who are familiar with me, hey y'all. For those of you who are new here, welcome, welcome, welcome. I'm Dr. Brittany Weinstock. I'm a family nurse practitioner and I'm the founder and CEO of the Nursing Studio. I provide resources, tools, review courses, review books, and videos to assist nurses as well as nurse practitioners with success on boards as well as in practice. I started doing this back in 2015, assisting nurses and nurse practitioners internationally with exam success, and I love to assist you as well as needed. But y'all know I always get into my disclaimer reminder that we know there's no absolutes in medicine. We treat on a patient by patient basis, and any of the questions that you see here, I have created and designed based on the current guidelines on the ANCC as well as AAMP exam. Now, any of the videos that I may teach on, if I am teaching on things that we currently do in practice, I will say that so there's no confusion. So, with that being said, let's get into question number one for today. Question number one states, a patient presents to the office today with complaints of heartburn that was noticed over the past week. She mentions that her symptoms are not frequent but noticeable. Based on these findings, what are the best initial steps by the nurse practitioner? Is it A, lifestyle modifications like six small meals a day and elevate the head of the bed? B, lifestyle modifications with the six small meals, elevating the head of the bed, and an H2 blocker as needed. C, lifestyle modifications with six meals per day, elevate the head of the bed, and a PPI as needed. Or D, have the patient to follow up in 1 week. Take a moment and tell me what you got in the comments, you guys. All right, you guys, I always recommend reading the stem of the question first so it allows you to slow down and ensure you're answering what is being asked of you. So here, the stem of the question states, based on these findings, what are the best initial steps by the nurse practitioners? So it's the best thing to initially do at this point. So what steps are we implementing and for what? So the patient presents to the office, they're having complaints of heartburn over the past week. They're noticeable but not frequent. So, with that information, what do we do? Are we going to start lifestyle modifications? Yeah, we do want to start lifestyle modifications. Do we want to start lifestyle modifications and H2 blockers as needed? Or do we want to do lifestyle modifications and a PPI as needed? Or just have the patient to follow up in 1 week? Now, I know heartburn, GERD, all the things can be very tricky. And that's why I'm giving you these kind of questions. So, this patient here has not had a GERD diagnosis. They come in with these heartburn style symptoms and she mentions that they're not frequent but noticeable, right? And so, of course, we do want to do lifestyle modification, but a classic thing here for this type of situation is that these heartburn symptoms are infrequent. So we can start with the best answer choice is B, lifestyle modifications and an H2 blocker as needed, and I'll tell you why. So if these were more alarming symptoms and um because this would be considered a mild case. So if there was like a frequent, I'm trying to find the best way to tell you this. So if their symptoms were frequent and more alarming, like they're having chest pain from it, or things that may appear before the GERD diagnosis that they have, potential esophagitis, if they have weight loss, or things like a GI bleed associated with this, then you could do the lifestyle modifications, a trial PPI, and refer them out to GI, right? But here in this scenario, they're having infrequent symptoms, right? She mentioned that it wasn't frequent, and she's only complaining of heartburn. So here we want to do our lifestyle modifications as well as instruct her that she can take an H2 blocker as needed, okay? Right? And so, those lifestyle modifications, you want them to avoid those triggering foods and drinks like your peppermints, your caffeinated things like coffee and stuff, your chocolates, spicy foods, tomato based food items, alcohol, all of those things, right? And you also want them to do six small meals versus three larger meals, making sure to tell them not to eat 2 to 3 hours before bed, sitting up after you eat so that your food can adequately digest instead of laying down right after eating. If they're overweight, you want to recommend weight loss for them, and not wearing any like restrictive clothing, your belt not too tight, and stopping smoking if they are, right? So those are all of those lifestyle modifications, and then have that H2 blocker as needed, okay? All right, so question number 2 for today. The patient returns to the office after starting the recommended lifestyle modification and Pepsid as needed. She states that she is requiring Pepsid at least twice a week. Based on these findings, how should the nurse practitioner treat? Is it A, prescribe Zantac, B, prescribe Tums, C, prescribe omeprazole, or D, nothing at this time, have the patient to return in 1 week? Take a moment and tell me what you got in the comments. All right, so similar question states, based on these findings, how should the nurse practitioner treat? All right, so y'all know I always say if they're asking for the treatment, you need to run it back and see what kind of diagnosis we have here. Have they provided us a diagnosis? Because if not, then we need to take it back a step further and look at the assessment findings to be able to determine what the diagnosis is, so we can know what we're even treating, right? So here this patient is returned to the office. This is the person that was just here. They were having infrequent heartburn symptoms. We did lifestyle modification and started them on a H2 blocker. The patient is stating that even after starting this and doing the H2 blocker as needed, she is requiring to take that H2 blocker at least twice a week. Now here, this is not no longer an infrequent situation, right? Because we already are doing lifestyle mods. We have them on an H2 blocker. They're needing this more than 20. So this is a frequent situation. So if they're having symptoms more than twice a week, then you're going to need some more assistance. So this is when you want to go with your C, prescribe omeprazole, because remember, prozole at the end is a PPI, right? So here we can implement those PPIs on a trial period, meaning we put you on it and see if you're having any relief from this, right? And we know that even though they're having more frequent symptoms, and I spoke of on the last question that they weren't like alarming symptoms like chest pain and other things like that, because sometimes with heartburn, with GERD, they'll have the chest pain. And as long as we have ruled out that it's not cardiac related and we're thinking it's associated with this, then you can go with these PPIs. So in this scenario, she hasn't mentioned anything like that. She's continuing to have those mild style symptoms, non-alarming symptoms, but they are frequent, right? And so here we want to go ahead and initiate a PPI to help. Also, in this scenario, it would be best that even though we're doing a trial period, we're not GI, right? So you would also want to refer out so that they can be assessed and things of that nature. But for now, C is your best answer. Go ahead and get a PPI on board for a trial period, okay? And then lastly, the third question for the day, the patient returns to the office after being seen by GI. The nurse practitioner notes that the patient was diagnosed with GERD. Based on this diagnosis, how should the nurse practitioner treat? Is it A, prescribe Pepsid, B, prescribe Tums, C, prescribe omeprazole, or D, nothing at this time? Take a moment and tell me what you got in the comments, you guys. All right, so stem of the question states, based on this diagnosis, how should the nurse practitioner treat? So again, you want to take it back and look for the diagnosis if they're asking you about a treatment. And they said here that this patient has been diagnosed with GERD. For testing purposes, when they tell you that there is an official GERD diagnosis, also for practice, when you have an official GERD diagnosis, we want to go first line with a PPI. Okay? First line is PPI therapy according to the GI guidelines now. Okay? So C is your best answer. Again, prozole being your PPI. H2 blockers used to be our first line therapy. It's not first line therapy when there's a GERD diagnosis. You can use H2 blocker, and that's why I gave you that scenario for that first question. You can use an H2 blocker if this is something that is infrequent, we don't have a GERD diagnosis, and they have mild symptoms. Go with the lifestyle modifications and H2 blocker. But the moment you see that this person has frequent symptoms, is not responding to this, or they have that official GERD diagnosis, you go PPI, first line therapy, okay? So C is your best answer. And then just sidebar, so you know your medicines, that Pepsid, Zantac, we don't even really use anymore, but those are your H2 blockers, right? They usually end in I and E, like your ranitidine, your famotidine, things of that nature, right? Remember, Tums are your antacids. So know your drug classes so that you're able to process through when you see questions in this format, okay? All right, you guys, I hope you found this helpful. I know the GERD and PPI versus H2 blocker controversy is a thing, and I'm trying to help y'all tie it all together so that you're able to identify and treat it appropriately and answer these appropriately on boards. So I hope that was helpful for you guys. So if you have any questions, put them in the comments and I can explain further if needed, okay? But as always, make sure you meet me back here. Be sure to like, comment, subscribe, and share with whomever you may find this beneficial as well. And if you need any other resources that I offer with the Nursing Studio, just give us a call at 803-400-6864 or shoot us a text message to this number. Also, you can email the nursing studio 1@gmail.com. You know, I offer a few things. I have the review book option either in the ebook or paperback, both linked in the bio of this channel. Also, there's a self-paced review course designed for family and adult GRO for the AANP and ANCC exam. They are also linked in the bio of this channel, the link to access that, and you're able to look at a preview and look at a preview of the downloadable workbook so you can see if that meets what you're looking for your study style. Our 5-week intensive review, which is a group review course, is currently going on right now. So just be on the lookout for our next one. I do those periodically throughout the year. And then lastly, our one-on-one sessions. I have 3 different one-on-one options where one being a weakness that you need to focus in on, or you can pick the option for exam readiness assessment or the option for a customized package plan. That customized option is for those like if you have been unsuccessful, you don't know what to do to get back started, you need a guidance structuring your studies and going from unsuccessful to successful is that customized package. But just let me know. I always say give us a call or shoot us an email so we can gauge what you truly need since it is so individualized. Um, and then we can go from there. So again, feel free to reach out to the nursing studio. But as always, make sure y'all meet me back here. Happy studying. Bye, y'all.